Okay, well, hi everyone. Thank you all for joining us. It's very nice to see some of you. Feel free to leave your cameras on or off, whatever you're most comfortable with. Today we'll be talking about how to adapt to cognitive changes during and after chemotherapy. I'm Mark Livshots. I'm one of the therapists at Cancer Wellness Center. I see individuals and couples for counseling as well as facilitate a number of our support groups. And one of my clinical interests is working with clients, whether it be those diagnosed or caregivers on what is called Chemo-Brain, or frequently referred to as Chemo-Brain. So again, feel free to take any notes or anything that you might want to, but also no pressure because, as Lisa said, you'll all receive the entire PowerPoint and the recording. So feel free just to take things in as we go. Let me make this a little bit smaller. And okay, so for today, my hope is that we can do a brief overview of Chemo-Brain. We'll talk about optimizing the nervous system. We'll discuss what's called the feedback loop of Chemo-Brain. And the majority of the presentation will be on, I'm sure, what you all came for, which is, so what do we do about it? What can I do to help? So we'll talk about a handful of interventions. And like I said, we'll try to leave as much time as possible for Q&A, just so that we can make it as interactive as possible. So we all know the endless list of side effects that chemotherapy frequently brings. So a lot of people know, the common ones such as hair loss, constipation, diarrhea, nausea, dry skin, so on and so forth. But not until relatively recently have the cognitive effects been researched. And memory problems and attention and concentration problems are both frequently reported side effects of chemotherapy as well. Chemo-Brain, as we'll discuss today, is the experience of new problems with memory, concentration, learning ability, and processing speed associated with chemotherapy. So the key part to this are new problems that are brought on following starting chemotherapy. Depending on the study, between 20 and 75% of individuals receiving chemotherapy experience Chemo-Brain. I know this is a big range, right? 20 to 75%, but the reason for this is every study defines it slightly differently and have different criteria for what symptoms or severity of symptoms fall into this. But even if we take, the smaller end of 20%, it's still 1 in 5 people receiving chemotherapy. The cognitive effects tend to be mild to moderate, yet persistent. So fortunately, most individuals improve within about a year to a year and a half after their last chemo treatment. And approximately 20% experience long-term effects. So long-term meaning beyond a year and a half. The good news, though, is that it's not progressive. And so what this means is that if an individual happens to be within the 20% that do experience Chemo-Brain long-term, cognitive impairment is not progressively getting worse throughout that time. There is a ceiling effect, so to speak, and there is a plateau. Here you can see 2 fMRI scans, and I'll describe what that means in just a second, but I love to start the presentation with these images just because it's very telling and helps visualize some of the effect of chemotherapy on cognitive functioning. So as I said, these are 2 sets of fMRI scans taken of a set of identical twins. And in psychology and neuroscience research, having identical twins as participants in your study is it's like winning the lottery. It's the gold mine. And this is because you're able to better discern if what is happening in your study is due to genetic reasons or if it's due to environmental reasons. And in this case, the environmental reason being having cancer and receiving chemotherapy. So MRIs, magnetic resonance imaging, which I'm sure many of you are familiar with, let you know the structure of a specific bone or organ But fMRIs, functional magnetic resonance imaging, lets you see activation of different brain regions by tracking blood flow, or changes in blood flow, I should say. And so in this set of scans, the top row is twin A. You could see labeled A in the top left corner. And the bottom row is twin B. Twin A has a breast cancer diagnosis and has undergone chemotherapy. Twin B does not have breast cancer and did not receive chemotherapy. And so in this study, the twins were asked to complete a task that tests working memory function. And we'll talk, I think, on the next slide a bit more about what working memory is. But as you can see in the scans, the twins were performing the same exact task. But twin A, the twin who received chemotherapy, has much greater activation and strain than her sister. And it's important to know for our purposes today that both twins successfully completed the task, though it was much more cognitively demanding for twin A. And so you can see here in the top row, in the frontal lobe, you can see much more activation as well as other regions of the brain. And we'll talk more throughout this presentation on specifically what areas of the brain can be impacted. But very interesting, really foundational study in chemo-brain research. I want to go over a handful of definitions of different terms that I'll use today, just to make sure we're all on the same page. And please don't stress yourself out memorizing any of this. This is just a very quick run through. And so I want to start with concentration. Concentration is the ability to absorb and process information. So for this, you're either concentrating or you're not. It's like an on and off switch. Attention is the ability to apply focus on an item. So for this, it's like a spotlight that you can direct. So concentration on off, but once it's on, you can direct your attention to something in particular. I know in just everyday language, we kind of use these interchangeably, but an important distinction here. Short-term memory is what helps us recall things that we just heard, saw, or read within the past few minutes. So, for example, were the twins in the previous slide identical or fraternal? That would be a question testing short-term memory. And if you're curious, it's identical. Long-term memory is the ability to recall things from a long time ago. So, and this ranges from 30 minutes ago to years. So an example would be what you ate for breakfast this morning or who your childhood best friend was. Working memory is what allows us to hold information in our mind. So we can use it to perform an act. So this would be like going into another room to get something or hearing a phone number in a commercial and writing it down. Lastly, memory consolidation is the structural neuronal change, so on the level of neurons in our brains, that leads to recently learned experiences being transformed into long-term memory. So very interesting process, that the study of neuroscience has revealed that when we learn and transform things that we just learned and consolidate it into long-term memory, that can actually be observed on the structural neuronal level. So very interesting there. A big idea surrounding Chemo-Brain is the notion of optimal arousal. And this can also be thought of as mental stimulation or stress. As it turns out, this is extremely important for memory consolidation and performance. Cortisol, which some of you may have heard of, is a stress hormone, and it's released by the adrenal glands in response to stress. So when functioning normally, cortisol reduces inflammation, increases sugar, glucose, into the bloodstream, and shuts down any non-essential bodily functions that are not needed in emergencies. The hippocampus, which is largely referred to as the memory center of the brain, and to simplify things, and the prefrontal cortex, which controls attention, have many receptors for cortisol. And so what this means is they are particularly sensitive to the effects of cortisol. In addition, cortisol also diverts blood flow and inhibits glucose utilization in the hippocampus, which means it has less access to energy. This chart, as you can see on the bottom half, shows a relationship between arousal and memory performance. If there's anyone here that might have a psychology background, this is referred to as the Yerkes-Dodson curve, if anyone's curious. As you can see, too little arousal leads to poor performance. So imagine just waking up from a long, deep nap and somebody asks you, where did you put your keys when you got home yesterday? As you're waking up, chances are your answer won't be that accurate or easy to retrieve. Similarly, on the other hand, too much arousal and your cognitive performance will be negatively impacted as well. So here you can imagine if sirens or fire alarms were going off all around you right now, you probably wouldn't be able to concentrate on what I'm saying right now as well as if you were in a calm environment. So the sweet spot, the Goldilocks effect, is right in the middle, where you have enough stimulation to keep your hippocampus and prefrontal cortex functioning, but not too much where it overwhelms your system. So interestingly, both internal and external processes can impact the amount of arousal and stress that your body experiences. So you could think of a stressful environment being, for example, a loud, crowded, overwhelming experience, in a grocery store. You probably won't, remember your debit card PIN number as well, perhaps. Another example, you're anxious about a doctor's appointment. This leads to a stress response, which we'll talk more about here in a second. And you don't retain as much information during your appointment. But anxiety and stress about the memory problems themselves can have this effect as well. And I want to show you all and walk everyone through this feedback loop. So I want to walk you through this feedback loop that individuals with Chemo-Brain frequently experience. So I'll try to click through as I talk, but forgive me if my pacing gets a little off here. But first, Chemo-Brain leads to having difficulty with daily cognitive tasks. And these tasks can be remembering where you put your keys when you got home, when your appointment time is, finding the specific word you're trying to think of, or remembering what someone said a few minutes ago. Plenty more examples, but just a few to just to get us started. This difficulty creates a subjective perception of a disparity between cognitive demands and cognitive abilities. So in other words, there becomes a gap between what is expected of your memory and attention and your current cognitive abilities. This frequently leads to a distress response, something like, this is so frustrating. I hate that this happens. I will never have the memory I had before chemo. This is so embarrassing. I'm sure this sounds familiar to many of you. These responses signal cortisol to be released, which further exacerbates Chemo-Brain. And so it's through this cycle that cognitive impairments are continuously amplified and prolonged. So another way of summarizing this is that the cycle of Chemo-Brain that induces a distress response, the high arousal state that this triggers leads to additional Chemo-Brain difficulties. But something that we'll talk about in just a little bit is there are actually ways to intervene in this process. Before we get to interventions, I want to show you a list of frequently reported attention and memory problems that are reported by cancer survivors. So just to name a few, recalling names, recalling things when trying hard, remembering faces of people recently met, following what people are saying, so on and so forth. Now I want to show you a list of common things people without cancer forget. Forgetting telephone numbers, forgetting people's names, losing car keys, forgetting appointment dates, so on and so forth. So the point of comparing the two lists is not to say that your or your significant others, cancer memory problems are just like everyone else's. That is not at all what I'm trying to say. But instead, these two lists demonstrate that not all memory and attention problems in daily life are due only to cancer or chemotherapy. Normal forgetting is a basic executive function of the brain that helps itself organize and reorganize what is important to remember and what is not. Some of you may have heard of a condition called hyperthymesia. There's a very interesting, I believe, 60 Minutes episode on this, which hyperthymesia is a condition where an individual remembers everything. And while it sounds, fascinating, or like, I wish I had hyperthymesia, right? Many people with this condition actually report profound experiences of suffering. They're burdened by every single memory they've ever experienced, every detail. And this can be quite overwhelming. And so, this helps illustrate the necessity of natural, normal forgetting. In addition to normal forgetting, short and long-term memory performance tends to worsen with age due to changes in biochemistry and patterns of blood flow to the brain. So much so that, in fact, your age at the time of receiving chemotherapy is a predictive factor of the severity of which you may experience Chemo-Brain. So the older you are, the more likely, the greater severity you may experience Chemo-Brain based on the age that you're first receiving chemotherapy. And vice versa, on the younger end, if you're receiving chemotherapy at a younger age, you may not experience Chemo-Brain to the same degree. I also want to go over these two lists to touch on how the excessive stress response that comes up when facing memory problems can exacerbate Chemo-Brain. So by understanding how other factors such as normal forgetting, age, stress, hunger, fatigue, so on and so forth, how they can all contribute to memory problems, this can help us start, to redirect our focus onto things that we can change. And we'll do that right now. The rest of the presentation will talk about a handful of interventions that can be helpful. And I work with clients on using many of these, and some work better than others based on the context or based on the person. So I'll go over a handful of different ones, and then it's up to you to, put these into practice and see what works, see what doesn't, see what's helpful. So the first intervention I want to talk about is called self-monitoring. And I cannot stress enough how important context is. Something I tell my clients frequently is context, context, context. And so by recording the context in which a certain event occurs, so much meaningful data can be derived by reflecting on all of the contributing and surrounding factors. So the time of day, level of distress, what was happening around you, how you were feeling right before and during the event, so on and so forth. So what happened? When did this happen? And what happened right before? These are all important questions to be asking yourselves as you think about what could be contributing to a time when you or your loved one are experiencing memory or attention difficulties. Some additional examples of contextual factors to consider are, your energy levels, so how tired you are, hunger, the lighting. I know something for myself is if I know it's a really bright or, on the other hand, really dim environment, you're straining to see. That all takes cognitive, or I guess it's all cognitively demanding, right? So it's taking energy and resources away from, again, the frontal lobe and the hippocampus. The time of day, so you might notice that correlates to how tired you are, perhaps. Your emotional state, right? Are you very distraught or distressed in that moment from something unrelated to the Chemo-Brain itself? stress levels, so on and so forth. And if you're interested, I do have a helpful worksheet that helps track some of this context, and I'll be sure to include it. I'll send it to Lisa, and that way, with the recording link, I'll ask Lisa to send out this form as well. So when enough recordings are completed of this context, patterns and themes can be reflected on, and changes can be made accordingly. So if you see that hunger is a common theme, you can make sure to pack some extra snacks in your purse or car. If stress is a problem, then relaxation techniques will be your best friend, and we'll talk about a good example in just a little bit. So what I'm trying to say in all of this is you have the ability to adapt to your experience and to mold it into one that improves your quality of life. The next intervention I want to discuss is self-instruction. And in self-instruction, the goal is to reorient yourself and focus on a task in order to not let internal processes interfere. So, for example, when trying to remember something and the right word can't come to mind, someone might say, shoot, my Chemo-Brain is so bad. I'm never going to remember things. This is so frustrating. This can be distracting, invalidating, can shut down the process of trying to achieve the goal at hand, whatever it might be. So instead, self-instruction is a way to talk yourself through the task. So I'll demonstrate with this, simple demographics form that someone might find at a doctor's office. And by simple, I mean really simple. It's probably the easiest form you'll ever see. But it can look something like this. All right, what is it I have to do? I'm going to fill out this form. Okay, let me see. First, I will fill out my name, Mark, M-A-R-K. Okay, good. Now my date of birth. Make sure I have the year right. Yes, I do. Okay, now I move down to my address. Okay, my address is 215 Revere Drive. Whoops, I put lane. Okay, that's okay. I'll just erase it and fix it to drive. I might hear a noise and I could say I'm distracted by a noise, but that's okay. I'm refocusing now. Let's fill out phone numbers. So notice the difference between I'm distracted by some background noise, but that's okay. I'm refocusing now. To I always forget the zip code. This is so embarrassing. I'll never have the mind I had before chemotherapy. The goal is to matter-of-factly, but also gently guide focus back to the task at hand. The best effects will come from talking to yourself like this during most daily tasks. And a good phrase is practice with the mundane as well as the meaningful, right? So, that is use self-instruction in virtually all tasks, such as, tying your shoes or getting keys out of your pocket or, sorting and folding laundry, cleaning and organizing clutter, or entering phone numbers, right? These everyday tasks. Even if the task seems trivial, it can be a good opportunity to, practice and hone your self-instruction skills. The goal is for self-instruction to become automatic and in good form when the pressure is on to perform well in important, non-trivial tasks. I have clients that quite, literally audibly talk themselves through this just for the practice, and eventually it becomes internalized and turns into this, self-narrative, or keep it external and just because it can be very helpful in that way too. So again, whatever works for you, but again, talking yourself through this through tasks can be helpful. So next, I mentioned a relaxation exercise, and I want to talk about progressive muscle relaxation, or PMR, as I'll refer to it, just because it can be a tongue twister. So PMR is an exercise where you lie flat on a mat, a couch, a bed, recliner, whatever is most comfortable for you, and slowly flex and relax a series of muscle groups as guided by a recording. And there are plenty that you could find on YouTube. Some apps have them as well. Just look up progressive muscle relaxation and you'll find thousands online. The reason for flexing the muscle group is because muscles actually relax more after they've been slightly flexed. The way I like to think about this is you can imagine how comfortable, that couch in the living room is after a long day. In this case, flexing, compared to how comfortable, the couch seems first thing in the morning. I'm sure the couch seems comfortable in both scenarios, but we all know how much more comforting it is after, a long day, or in this case, a few seconds of flexing. When doing this exercise, of course, please listen to your body and do not flex or strain to a point where it hurts. If you cannot flex or want to avoid flexing a certain muscle group, you can just focus on direct attention and energy and focus on that group and relax during that part and pick back up at the next muscle group. PMR helps build the skill of self-regulating arousal. So if you think back to that upside down U graph, PMR helps you take control of your own arousal state instead of hoping that the high arousal state will eventually decrease on its own. You do have that control. So reducing arousal helps improve attention, which leads to improved learning of information for future recall. So remember, if you remember that the stress response diverts blood flow and glucose utilization in the hippocampus, the memory center and prefrontal cortex, which is attention. This is a way of, regaining some control in that, the response in your nervous system. The sympathetic nervous system is the part of your nervous system that helps you fight and run in case of emergencies. So on the other hand, the parasympathetic nervous system helps you recover, relax, and helps you restore your energy levels. A good way of memorizing this is you can think of this as skydiving. Sympathetic nervous system is the exhilarating, screaming part of the dive. Or what I imagine to be, I've never gone skydiving, but the parasympathetic nervous system helps you slow things down. And this is helpful because parasympathetic is like the parachute. The sympathetic nervous system is quick and powerful, but it can't last forever. So PMR serves to balance and counteract that nervous system's response to stress. The vagus nerve, which is one of the main nerves of the parasympathetic nervous system, consists of nerves traveling between the body and the brain, and messages travel 80% towards the brain and 20% in the direction of your body from your brain. And so why this is so fascinating is because this means that your brain is constantly taking cues from your bodily sensations. So if your muscles are tight and flexed, your sympathetic nervous system interprets that as cause for being on edge and in an activated, heightened state. But by relaxing unneeded muscles, this helps balance the system and tell your brain that it in fact is safe and regulated. And so why this can be so helpful is you can do this from the comfort of your bed or your couch, but also in your car, before going into an appointment, or even in the waiting room, or even in the appointment room itself while you're waiting for your provider to walk in. This can be very helpful, and again, just another tool in all of this. The next thing I want to introduce to you all is rehearsal and chunking. And let me kind of just put all of these up just so that as I go through this, you can all read along as well. Overt rehearsal is repeating it out loud. And so let's say you're at a dinner party, or you just met someone. What this could look like could be, hi, nice to meet you, Jane. Jane, nice to meet you. I'm Mark, right? These are just examples of if you just meet someone named Jane. I'm not sure if there's a Jane here, sorry to pick on you if so. Saying the name out loud in a couple of times can be helpful because again, it's this out loud rehearsal, and something we know about memory consolidation in terms of what your brain decides is important to hold on to versus not, it's repetition. Um, Covert rehearsal is repeating to oneself silently. And so, same example, but to yourself, either out loud or thinking to yourself, the lady over there is named Jane. As I said, spaced rehearsal is making the time interval gradually longer between repetitions. It could be, hi, Jane, nice to meet you. And then, you walk away, take your seat, and then to yourself, Jane. Then you look back and say, okay, Jane. A few minutes later, you think to yourself, who was that? Oh, that was Jane, right? This is a way of over time increasing the time interval between repetitions. And this is a great way, medical students use this when, memorizing millions of different terms. This is a proven technique in making sure something is actually consolidated into long-term memory. Chunking is another technique. And in chunking, you can batch groups of numbers together. For example, 7841 becomes 78 and 41, or 000 becomes 000. And we know chunking works because, commercials use it all the time. And if it didn't work, they wouldn't use it. One thing I wanted to mention too before moving on is going back to spaced rehearsal. And one of the reasons this works is because with, again, additional repetitions, the neural circuits that are involved in consolidating this memory are strengthened, and therefore it makes the recall more efficient in the future. You can think of almost like making tracks in the snow. You could see where many people have walked before, and that way you're not, trudging through the deep snow next time you go, but you're going in that same path. And that's essentially what's happening in spaced rehearsal. Rhymes can be helpful as well. This can be helpful with consolidating names, tasks, really at any topic or category. So for names, again, sorry if there's a Jane here, saying to yourself, Jane from Maine. Even if Jane is not from Maine, right? It rhymes. It can be helpful to remember it that way, right? Mark with teeth like a shark. I hope that's not the case, but if that helps you remember my name, that's fine too. Denise has geese, right? These types of rhymes can be helpful in memorizing names, but tasks as well. So some examples are, if you're trying to remember to take pills, in my research, something I came across was, to be like Edison, take your medicine. Or if you're trying to remember to go to the store later, I'm on the floor until I go to the store. It doesn't have to be factually accurate, right? It's actually okay, and actually even better if the rhyme itself is somewhat, mean or unflattering, humorous, witty. Emotion actually deepens memory consolidation. Again, the rhyme doesn't have to be factually correct, but something that to you is, funny, witty, or anything, it's more likely to stick. Jingles or musical melodies can be helpful as well, and it's very useful. And you can just think how effective the McDonald's jingle is, right? It helps us remember whatever we're trying to remember. Other tools that can be helpful are schedules, calendars, and planners. And I'm sure I'm not the first one to tell you all that having a calendar or a planner is helpful. Instead, I want to just give you a few considerations when using any of these tools. These are meant to assist in organizing your days as to not again, overwhelm you by multiple tasks that you have to hold in your working memory, right? If I was in my mind trying to remember my entire week's worth of clients, that would be impossible, right? But also very stressful and very cognitively demanding. So by externalizing it and knowing, okay, it's all in one space, that can help me know that, okay, I don't need to hold on to this. I can always just turn to my calendar. Um, a consideration is, and again, there's no right or wrong answer, whatever works best for you. But many people, many clients have asked me, should I use something on paper or an electronic calendar? And, there's pros and cons of both. If using paper, I recommend using a planner with one page for one day, and it has hourly slots. And the reason for that, and again, it doesn't have to be a whole page, but more than just a small square. But the reason for that is, if you're writing in small, kind of crammed areas, if you have to change something, usually I recommend just having more space so that you can move things around if needed, scratch things out, write over it, so on and so forth. Again, writing in pencil can be helpful because, as I said, instead of scratching it out, you can actually write in that same spot and keep it more organized. I also recommend keeping one schedule that includes all of your medical, personal, and professional responsibilities. So instead of having one calendar with, work meetings, another calendar with, your oncology and physical therapy appointments, for example, and a different one with personal things, it can become very disorganized. And especially if, memory and attention is an issue, it can be helpful just having everything all in one place. Another pro of using a paper system is that it doesn't have to be charged and will never run out of battery, as many of our devices do these days. And no setup or software updates or anything getting in the way. If you rely on alarms, they can be very helpful, but if your phone dies, the alarm's not going to go off. For electronic systems, you can use Siri or Google Assistant. In case you have any of these home, I won't say the trigger words, but you could tell it to remind me to buy milk at 5:30 p.m. today, and your device will do so. It can be easier to color code in an electronic system. So, for example, in my personal system, if it's something clinical with a client, it's purple. If it's a meeting, it's yellow. And that way, at first glance, I can just see, get a glimpse of what I have coming up that day or week. You can also set custom notification times. So I put it, friends and families, birthdays in my calendar and set a custom notification time of not just day of, but also 3 days before, so that if I didn't write a card or get a gift yet, it gives me, it's a helpful reminder to do so. And some recommended apps, and of course there's probably hundreds on the different app stores, but Google Calendar is a very easy one to use and can sync with other devices. And Habit Tracker is another one where you can set up a habit, such as taking your medication every day at 10 a.m. And every day at 10 a.m., your device will remind you, and you can even say yes or no if you did it, so that way you can go back and see, did I take it today or not? Some other, benefits of using an electronic system is it can be shared with others. So if you have a caregiver or a loved one that either you're assisting with or helps you, they can be notified of these events or tasks as well. You can add notifications, as I said, but it can also be synced between all the different devices we have these days of phones, tablets, smartwatches, computers, and so on. You might notice this last bullet point, which can be controversial, but I'll make my my argument against or I guess for the case of avoiding to-do lists. The reason I usually recommend avoiding to-do lists is because they fail to provide a visual overview of how much can realistically be completed or accomplished within a limited amount of time. So for example, on a to-do list, if everything is a bullet point or a checkbox, a task that takes 3 hours takes up the same amount of space on that piece of paper, for example, as a task that takes a minute to complete. And so this can be hard in planning your days or your time. And so the reason I like a calendar that has hourly slots is so that you can block off realistically, if you know an appointment, you have to drive, let's say, downtown, the appointment itself, plus driving home in traffic. You can block off realistically a few hours, and that way it helps in organizing that system. But again, if I get this question a lot, if you have been using to-do lists, you have your system and it works for you, by all means, please do not stop doing that. But I always just like to mention the case against to-do lists. And it can be helpful, excuse me, it can be difficult seeing, a to-do list that you set out, but if you don't accomplish it, it feels defeating, right? And so that way, having allocated time for it, and if you don't do it, you can allocate more time on a different day. So I want to finish off by adding a note of self-compassion. And I understand that many of you have faced frustration, anger, or resentment towards your or a loved one's experiences with Chemo-Brain. And alternatively, some of you are anxious about possibly experiencing Chemo-Brain in the future. As you implement these techniques, I hope you notice progress and shifts in your Chemo-Brain symptoms. But of course, there's a likelihood that a couple of times of practicing these skills isn't enough to notice a complete shift or a huge difference in those symptoms. But I hope that you can remember that taking care of your cognitive and mental health is an ongoing process, and repetition and practice helps solidify these skills. But there will be ebbs and flows in your experiences, and I hope you all can remember that that I can continue to be a resource for you all as you begin to implement these skills. So I'll on the next slide you'll see my email address, and you could see it on our website as well. So if anyone has any questions or wants to talk through any of this, following today's Q&A session, please feel free to reach out. But just a reminder to practice these skills, see what works for you, see what doesn't. A challenge I always give clients is if you need something to practice, to memorize one phone number. It could be a friend's phone number that you don't have memorized. Here's a phone number of Cancer Wellness Center if you need an example. I also like the idea of going on a walk or I guess with the recent cold, maybe a drive to a new destination, right? You can look at the directions ahead of time on your phone, see what techniques you can use to help you, whether it's rehearsal and chunking or, self-instruction, and, go for that short drive and see if you can get to the destination without using GPS. Of course, be safe, go to, stay in an area but it can be a fun challenge too. Here is my email address, mlivshots@cancerwellness.org. Of course, please feel free to reach out with any questions, however I could be of help to you. I will actually, I'll stop the recording here. So this will be the end of the recording for YouTube, and then